A patient with severe hepatic impairment receives unusual doses of a drug metabolized by CYP450. What is the priority? Well, let's think about what is CYP450. That is an enzyme in your liver that metabolizes shit. A patient with severe hepatic impairment receives a drug that is metabolized by the liver, is what this is asking. Okay, what should you expect? A reduced toxicity risk? Should you monitor them closely for accumulation or adverse effects? Increase dosing frequency to maintain levels, or should you switch to extended release formulation? Well, they can't metabolize it, so you don't want to have it extended release. Increase dosing level to maintain levels. I don't know if you remember, but we give old people less because they have lower function of their liver and kidneys. So we would not want to increase dosing, connect those two things together. Um, Expect reduced toxicity risks, that's just stupid. And then monitor closely for accumulation and adverse effects. That is the most obvious answer I have ever seen. Which route has no absorption barriers and allows precise control of plasma drug levels? Which route has no absorption barriers? We've done this like 17 times. Which one is an instantaneous thing? IV, baby. Ew, why did I say that? Um, yes. Okay, which opioid should be avoided for long-term use due to the toxic metabolic accumulation? This one, I don't think we have reviewed at all, but it is meperidine. 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 Oh, me perp is dying because I took too much of this drug and now I don't feel good. Yeah, me perp is dying. Um, yeah, well, it's not morphine and it's not fentanyl because you know people are on those for a long time. Methadone is used for drug like opioid withdrawal almost. It's like one of those things that they give you when you're trying to get off of shit. So yeah. Oh, and this one, methadone, that's also important about this. Methadone gets rid of cravings. The other one that they give for it, let me find it. Um, Naltrexone, Naltrexone, naltrexone. That is the same idea. They give it for opioid people who don't want to be on opioids anymore. But the issue with this one, naltrexone only gets rid of euphoria. It does not get rid of cravings. Methadone gets rid of cravings. I don't know if we're going to even be tested on that, so either learn it or don't. Which oral opioid requires a baseline and periodic ECG due to risk of dysrhythmias? Okay, morphine. Have you ever known someone on morphine? Do they get ECGs? No. Codeine. They wouldn't give you codeine to take home if they needed this. Hydrocodone, same thing. They would not give you this. This would not be a take home kind of thing. So which one of these things can you not take home? Well, you can't take home morphine. I'm pretty sure. Maybe you can if you're like a cancer patient or something. Um, and I don't know about methadone. I've never even I just learned about this one when we started this unit. Same thing, methadone. This is the one that they give you when you're in withdrawal. And this is the right answer. The way that I remember it is meth done give you a heart problem. If you do meth, maybe you'll get a heart problem. You know? Meth's not good. Methadone. I'm methadone, bro. My heart, I did meth. I'm methadone. Methadone. I'm looking for the blue M30s. I believe they're called the perks. I hope one of you get that. Okay. Which medication can precipitate withdrawal if given to a patient actively taking a full opioid agonist? Which medication can precipitate withdrawal if given to someone who is taking a opioid agonist? Naloxone. Naloxone just stops it all. Codeine, that's a pure agonist. Fentanyl, that's a pure agonist. So we're between these two. But if you recall, when we had a question about this, it had these same words. Buprenorphine. Buprenorphine. Do I have any notes on this one? Other than the only notes I have on there is that it can precipitate withdrawal. Buprenorphine. Connect these words with that word. Okay, which benzodiazepine is a prototype to which benzodiazepine prototype is emphasized for anxiety and insomnia? I don't know why it says that in the end. Zolpidem, Trazolam, Secobarbital, or Ramelon. Okay, I'm gonna give you a little secret. We're actually going a little ahead of this. Secobarbital has barb in the word. This is a barbiturate. This is not a benzodiazepine. This is a barbiturate. It's a completely different thing. It's like the opposite of all the good thing about benzos. Are directly inverse of barbiturates. So, yes. Rameliton. There is a M-E-L, mel, Ram-mel-eton. I'm not even saying that right. This is a melatonin agonist. This turns your melatonin on and says, hey, hello, how you doing? Time to go to bed. Not a benzodiazepine. Melatonin agonist. Barbiturate. And we have those two. And this is the one that I actually can't tell the difference between. Oh, okay, I see. Oh, okay. They're both. Am I on the right one? Triazolam. Okay, triazolam. Where is this one? Pedem. Epin. Oh, okay. This is a hypnotic. It's similar to a benzo, but it is not a benzo. I'm pretty sure this is like Ambien and stuff. We'll come back to that. I'll amend that later. The answer, benzo prototype, is triazolam. Dude, oh my god. You know how fucking dumb I am? It ends in am. It's the only one in this whole list of things that ends in am. Okay. Fuck it. That was ridiculous. But you know what? Triazolam, that's the benzo. This is a hypnotic-like. This is a barbiturate, barb, ramelation, melatonin. Okay, glad we got that out of the way. The nurse educates a patient about Zalplan. Which statement shows an understanding? It's for long-term seizure control. It helps me fall asleep and has a low tolerance risk. It prevents sleepwalking. It treats chronic pain. Okay, so I shows understanding. Okay, never mind. I'm like, all of these are wrong. I got it. So, Palan, that actually doesn't really help in this situation. This is a benzo. Maybe just remember, because like Z. Me. Sleeping with Z's. Um, it is long-term seizure control. No. Z. I'm sleeping. Me. You know, prevents me from sleepwalking. I mean, does it? I think it actually causes sleepwalking. I'm not gonna lie. And this is a benzo. This is not for pain. It helps me fall asleep and has a low tolerance risk. Yes, sir. That is the correct one. Which barbiturate prototype may be used for seizures and insomnia but has a high risk of respiratory depression? Well, let's look. That's our melatonin agonist. Here's our barbiturate, sacobarbiturate. Plan, we just did that. And this one above, that is a benzo. And then zolpidem. Same thing. I'm pretty sure this zolpidem. Let me find it. Oh, we did it later. It's not a benzo. It's not a benzo. It's not a barbiturate. It is a benzo-like hypnotic. So here we have the only barbiturate in the entire section, seco barbiturate for seizures and insomnia, and it might kill ya. Which drug activates melatonin receptors to induce sleep without dependence risk? Okay. We have the hypnotic. We have what is this? Oh, this is, we'll get to that one later. We have melatonin, or we have a barbiturate without a dependence risk. Remember what I said about barbiturates earlier? Barbiturates are everything benzos are not. They are highly abusable. They are, I think, pretty dangerous. I gotta bring up the graph. I'll look at it. But yeah. And then, see, oh, I remember this. I don't know how to explain this one. You have a receptor in your brain called the, let me find it, orexin, Orexin. Orexin. And this receptor promotes wakefulness. This receptor makes it so you wake up in the morning and you get out of bed and you pull the things down and you stretch your arms up and you go, oh, it's going to be a great day because I'm so awake right now. That is because of Orexin, or orexin. This is an antagonist of that, so it blocks the orexin receptor and says, hey, go to sleep. This starts the melatonin receptor. But here's the big thing about this question. Which one can you get dependent on? I'm pretty sure it is. What fucking question am I on? I'm pretty sure it's this one. Because melatonin, I don't think there's not a very high rate for, or high risk for abuse. 34. C. When is there Y? Ramilatin is a melatonin receptor for sleep with minimal risk abuse. And then the rationale for the other ones is it has different mechanisms. Yeah, great. That's exactly what I was looking for. Okay. Which orexin receptor antagonizes, which orexin receptor agonist promotes sleep and is scheduled for? I don't know. We just did this. Is it the melatonin one? Is it the, wow, why can't I remember? It's the Z's that are getting me. Is this the hypnotic one? Or is this the, yeah, that's the hypnotic. We gotta figure out a word to remember that. Or is it trilozosam, which is a benzo? Wow, I'm gonna guess it's suvoraxant. And do you know, I don't really know, there's a V in there, and there's an X in there, so maybe just go, oh, there's or, like, Minecraft. Oh no, there's ors in this word. Or. O-R-E. O-R-E. Oh, vor. Oh, vor is when it's like porn that like they like to eat people in, so maybe like or X. Porn. Or porn. I don't know, I'm trying. And you guys are gonna be like, oh, ABC benzodiazepine. Oh, wait, no. ABCNS depression. And you guys don't remember that one, but I can. Which migraine drug is contradicted in pregnancy and in patients with CID due to vasoconstriction? This is basically saying which one can you not take if you're pregnant and you have a migraine. Ergotamine is, oh, I'm just gonna open my notes on this one. I'm kind of cheating over here. Kind of, not really. Oh, yes, okay, that's what it was. This has a dependency risk, and it didn't say that it directly causes birth defects, but one of these does say that it causes birth defects, which was sumatriptan. This is the one that was on the ATI example. It was you need to use contraceptions because you don't want to get pregnant while you don't want to get pregnant or be pregnant while taking this. God, are those all my notes I took on it? Or did I take any notes on it? Of course I didn't, because why would I? But yeah, so sumatriptan is it's usually the first choice for migraine abortive therapy of migraines. There's two different types of therapy. There's abortive and there's preventive. These three are all abortive. This is the first choice. This is the second choice. This one has a lot more adverse effects. This one is a whole different antagonist, so I'll tell you about that one later. These are serotonin antagonists, or agonists, sorry. They produce serotonin. So then you can also remember you are at risk for serotonin syndrome if you take an SSRI with this. A patient daily taking ergotamine reports cold, numb fingers and muscle pains. The nurses suspect, yes, this is a thing. When you take this medicine and you have a toxicity from it, it's called ergotism. Uh, ergotism, you know? Ergo, got the tism. Remember? Like autism. So ergo. I mean, maybe you just remember because it's ergo and ergo. I don't know. I'm trying. Okay, which migraine medication blocks CGRP receptor? So you have your two serotonin agonists. These turn serotonin on to try to get rid of a migraine. And then which one? This is something that also causes a migraine, so you want to get rid of this. And that is it acetaminophen? Does acetaminophen cross the blood-brain barrier? No. I'm pretty sure they're in the head. I imagine they're in the head. The answer is Gepant. There's nothing really that you connect it with, but like Gepant, CGRP. That's stupid. NSAID reduce pain and fever primarily by, I wonder why, do they block the opioid receptors? Do they enhance serotonin? Do they antagonize dopamine receptors? These are all in your head, by the way. Or do they inhibit prostaglandin synthesis, which is COX 1 and 2? That's right, it's B. They inhibit prostaglandin synthesis. Which analgesic is hepatotoxic in overdose and warrants monitoring for jaundice? Okay, where is ibuprofen metabolized, or whatever the word is? Where is it? What organ does this affect? Kidneys, yes. Aspirin. I don't know I don't know where aspirin is. I don't know if it's in your kidneys or your liver. And I don't know about naproxen either, but I know naproxen. I know that the answer is hepatic toxic and jaundice. So you're like, oh, jaundice? Kidneys, acetaminophen, Tylenol. Which patient has greater risk for NSAID related renal impairment? Teen with an sprained ankle, adult with minor hypertension, older adult with chronic kidney disease, or child with a fever? I wonder. The people whose kidneys don't work? Which classic sign is associated with significant opioid effect? Mydriasis, dilation of the pupils, meiosis, nystagmus, movement of the eyes. Oh, that's when they go like this. Yeah, And then diplopia, double vision. Okay. Big eyes, small eyes, twitchy eyes, or eyes seeing twice. It's small eyes, pinpoint pupils. Which opioid formulation is available as a transdermal patch for opioid tolerant patients? I wonder. You're right, it is fentanyl. Fentanyl. Why did I say it? I said it like Dr. Kanga says it. Fentanyl. Fentanyl. Which moderate to strong opioid is effective for cough suppression and is often combined with non-opiates for analgesia. Well, we talked about that. It's not oxy. It's not tapentadol. Methadone, which gets rid of that. I mean, or codeine. Just think of hydrocodone. You know, codeine. Ugh, I wish Brandon was here to ask him. He knows all the codeines. He didn't do it, but his friends did. Combining sumatriptan with an SSRI can lead to which condition? Okay, let's think about what does a sumatriptan antagonize or agonize? That's right, serotonin. What is an SSRI? That's right, a selective serotonin reuptake inhibitor? I don't know. SSRIs are great though. Which condition? Neuroleptic malignant syndrome. That we had in pathophysiology. That was that. I think that was the redhead anesthesia. Serotonin syndrome, red man syndrome, malignant hypothermia. Just kidding. That was the redhead one. I don't know what this was. That was from the psych meds. Okay, yes, the answer is B. So, serotonin syndrome. Which I feel like is super, like, kind of obvious, but maybe it's not. Which analgesia acts as a weak mu agonist and inhibits norepinephrine reuptake? Okay. We've never talked about this ever. Methadone. We know this one. Methadone. Oh, wait, hold on. I made that up. No, wait, yeah, methadone is for, yeah. It's the other one that's for, yeah, I can't even think anymore. I don't know. Methadone is the one you take. Methadone. Damn. Meth had done me bad with my heart. Dysrhythmias. Codeine, tapentadol, or buprenorphine. It's tapentadol. 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 Do I have any notes on that? Oh, Goopy, you're drooling on my arm. Gross. Smells like butthole. Of course, I have no notes on it. Did I write anything useful? Can't even find it. Yeah, fuck that. I don't know. That's the answer. It's an agonist antagonist, just like this one. Unless it's that. Now you got me second guessing. I don't know. No, it's that one. I know it's that one. I can't tell you why it's that one, but it is. It is tapentadol. Is a selective thing. It weakly activates a mu receptor and it inhibits norepinephrine. So, I know I have notes on this somewhere. I just don't know where they are. I don't know. Oh my god, should I have a face cam in the corner like I'm a teacher? Does it not work? Oh my god. Stop. Why does my hair look like that? Oh my god. Okay, yeah, no, we're done with that. Which agent treats opioids-induced constipation by selectively blocking GI mu receptors without reversing analgesia? That's right, we talked about this at the beginning. The answer is B. I don't think we'll need to know that. And let me make sure that it's not just... Hello? What is that blue box? 47. Okay. Uh, oh, okay. Yes, that's right. They all do different things. This is the only one like that. Which finding represents an unavoidable side effect rather than a true allergy? Did we not do that? I feel like we did this. Constipation from opioids, anaphylaxis after penicillin, angioedema after lisinopril, or urticaria after sulfa antibiotic. I feel like we did this, but I mean, think about what is an allergy and what is a side effect. And yeah, it's gonna be it. Which term describes birth defects? Teratogenic. This is carcinogenic. This is cancer. This is idiosyncratic. Is unknown, right? Yeah, unknown. And then mutagenic. I don't know what this is. Did we? Genetic mutation. Okay. Last one. Which is an example of an aereo alatrogenic disease? Iatrogenic disease. We learned this in patho. Antibiotics resistance in community, nausea from chemotherapy, opioid withdrawal after abrupt cessation, or drug-induced Parkinson's from antipsychotics. Well, what are these? What are the common things? Antibiotic resistance in a community. That is, I feel like a community herd. No, it's something. That there's a vocabulary word we learned before about that. Opioid withdrawal after abrupt cessation. That's not a disease. I mean, that's just quitting. And then nausea from chemotherapy is a side effect. So we have drug-induced Parkinson's from Parkinsonism from antipsychotics. Yes, relating to an illness caused by a medical examination or treatment. So it's more of like cause and effect of a drug giving you something else, kind of. Okay, that's the end of it. That's me reading them all out. Everyone have a good day at work or driving your car, or whatever you're doing.